Today we'll be talking about Cavovarus foot, a deformity of the foot that's commonly seen in children. We'll be talking about what it is, what causes it, its symptoms, and how we treat it. So stick around. So what is a Cavovarus foot? A Cavovarus foot deformity is a condition where the arch of the foot is abnormally high, hence the term cavo, and the heel tilts inwards, and that's where the name varus comes from. When in children, when you see this in children, can cause walking and standing to be challenging and uncomfortable. So you might notice that the foot looks a bit different compared to like the typical appearance of the foot, and the arch looks more pronounced than it normally is, or the heel may tend to face inwards a bit. So now let's talk about the cause of Cavovarus foot. Now, what causes this condition? It's important to know that Cavovarus deformity often results as a result of an underlying condition. So these include things like neurological conditions, so things like Cavovarus tooth disease, cerebral palsy. All these can lead to muscle imbalances and ultimately cause the foot to develop these deformities. Also, some conditions affecting the spinal cord like spina bifida or tumors of the spinal cord can result in deformities of the foot. Another is trauma, so injuries around the foot or the leg that affect the muscles of the bones can also result in this deformity. Another is congenital factors, so some children are born with structural abnormalities in their feet that lead to this condition to present. Another cause is cause of idiopathic causes. Sometimes the cause isn't understood. So understanding the underlying cause is crucial because it guides the treatment. Now let's move on to the symptoms of Cavovarus feet. So what symptoms should we watch out for? Here are the most common signs. One of those is unstable walking. The children may seem to wobble or trip frequently as they walk. Sometimes they can complain of pain. So the pain is in the foot, especially after activities. They could develop callosities on the foot. So the calluses are normally noticeable on the outer aspect of the foot. They also complain about ankle sprains, and they are at risk of getting frequent ankle sprains, and this is because of the inward tilting of the heel of the foot. So now let's talk about treatment. How is the Cavovarus foot deformity treated? So the treatment plan often depends on the severity of the condition and the underlying cause. So here are the approaches that we use when treating a Cavovarus foot. One is physical therapy. The physical therapy is important in availing exercises that can be used for strengthening of the feet and the leg muscles, and also help improve the balance and the alignment of the foot. Another option is orthotics. Custom shoe orthotics are available to the children, and these help provide support and improve the position of the foot. The orthotics are custom made, and they're typically used in feet that are quite flexible. Another option is surgery. The surgery is proposed in more severe cases, and it's needed to correct the foot alignment. Okay, this could improve the line. This could improve align the bones of the foot, lengthen tight muscles. It can help transfer tendons and help restore balance to the foot. So, like we mentioned in the start, treatment of the Cavovarus foot doesn't just deal with treating the foot, but also the underlying condition. So, if a neurological condition is present and it's the cause of this deformity, managing that is very important in preventing the recurrence of this condition and also helping improve the alignment of the foot. So what are the takeaways from this? Cavovarus feet deformity are concerning to the child, to the parent, but with the right care and the right treatment of the child, most children can live active and healthy lives. So it's important to diagnose them early and work closely with your doctor, when this has been diagnosed, and know the different options available to treat the child. So as always, thank you for tuning in, and keep it on Little Growing Bones. Thank you.